Good morning, everyone. I am Richard Magullado, the Information Officer and the Adolescent Health and Development Focal Person of the Commission on Population and Development Region 6, and I am here today to discuss with you Iloilo City's journey in developing adolescent-friendly facilities and approaches. Iloilo City, known as the City of Love, is not just a cultural treasure. It is rapidly evolving into a vibrant hub of economic and infrastructure growth in the Visayas. Over the past 2 decades, the city has transformed into a progressive metropolis, attracting thriving businesses and students from across the Visayas, Luzon, and even Mindanao. As the city grows, so do the complexities and challenges of its youth population. Shaped by rapid modernization, Iloilo's young people face an evolving landscape that includes early sexual debut, risky behaviors, and mental health struggles. By 2019, the city's Adolescent Health and Development Program was at a critical juncture. With a change in political leadership after Mayor Jerry P. Treñas took office, there was an inevitable shift in the leadership of key city departments, including the City Health Office. This transition coincided with the retirement of key AHDP personnel, leaving behind a significant legacy. The Integrated Service Delivery Network, or ISDN for adolescents, which is supported by a local ordinance and led by the City Population Office, the City Social Welfare and Development Office, and City Health Office, was strengthened by the guidance of the Commission on Population and Development Region 6, the Department of Health Western Visayas Center for Health Development, and committed partners like the Family Planning Organization of the Philippines. We also have the Iloilo City Regulation Ordinance 2017-048, which establishes every Friday as Adolescent Day across all health centers in the Iloilo City, dedicating a specific day each week for focused services and support for the city's youth. Despite the progress, the pandemic struck just as the program was gaining momentum. Health services were redirected towards emergency responses, and adolescent services such as family planning and mental health were severely disrupted. The city's young people, comprising over 18% of the population, were left to face these compounded challenges alone. Adolescent pregnancy, which had temporarily declined during the pandemic, began rising again. As we can see in the graph, the adolescent birth rate, which is at 20.63 in 2021, rose to 26.75 in 2023. In 2022, Iloilo City partnered with the Challenge Initiative, marking a significant moment in the reinvigoration of its Adolescent Health and Development Program. This partnership, driven by the City Population Office, provided the much-needed technical expertise and strategic guidance to navigate the transition. Our first engagements, conducted virtually due to the pandemic, included leadership orientations and the introduction of the TCI assessment tool. This tool gave stakeholders a new perspective, acting as a mirror that reflected both the challenges and untapped strengths of the program. With TCI's emphasis on locally owned solutions, the program quickly gained solid traction, empowering local leaders to take ownership of their goals. One of our first victories came with the revival of the information and service delivery network. Although disrupted by the pandemic, the network was re-energized through TCI's collaborative model. New and experienced program officers found direction and confidence through TCI's tailored training, coaching, and tools. The Health Leadership and Management Program was transformative, helping local coordinators see themselves not just as administrators, but as community leaders, advocates, and change makers. TCI's leadership approach instilled a sense of purpose, rooted in equity, inclusion, and accountability. The City Population Office led the charge on demand generation, launching innovative initiatives alongside traditional strategies. And inspired by the TCI University and its high impact practices, we have conducted these activities. Katin-Aran MOU and Teen Hub at Nabitasan Integrated School, which created a safe, structured space to address social and reproductive health issues among marginalized youth. Balay Katin-Aran in Barrio Obrero also hosted activities like poster contests and family-focused discussions to raise awareness about relationships and sexual health. Newscasting, which is a citywide innovation and also a newscasting competition, gave our teens a platform to practice public speaking, media production, and ultimately build their confidence. We also have our Teen Ad Facebook group, which engaged over 2,900 members with adolescent-focused content and services, creating a digital hub for our youth. The Shape A teacher training also empowered our educators to better support students, positioning schools as key players in the adolescent health and development program. The Iloilo City government has also undertaken SBCC and AHD classes, the parenting talks, and peer helpers training, which ultimately promoted healthy decision-making, behavior, and peer support, reaching hundreds of youths and families across the city. We also have Family Planning Days, which is organized in each district, connecting women and adolescents directly to reproductive health and family planning services. A major breakthrough came with the retooling of the seat of the Barangay Service Point Officers, or the BSPOs. Understanding their crucial role at the grassroots level, the City Population Office launched a comprehensive retooling program for all 224 Barangay Service Point Officers across Iloilo City. Armed with updated tools and knowledge, aligned with the family planning indicators and the Field Health Services Information System, or FHSIS, the BSPOs became empowered frontline educators and mobilizers in every barangay. Their efforts ensured that the messages of the AHDP reached every corner of the city. In a significant step towards inclusive youth engagement, the City Population Office also trained out-of-school youth as peer facilitators, ensuring that even the most marginalized young people have a voice in adolescent health efforts. These youth were empowered to take on leadership roles within their communities, providing youth-led support for the Adolescent Health and Development Program. By equipping them with knowledge, facilitation skills, and a strong sense of purpose, the program not only expanded its reach, but also reinforced the importance of peer-to-peer influence in promoting healthy behaviors and informed decision-making among adolescents. The city also saw Strong policy support with local ordinances and executive orders reinforcing national goals. We have Ordinance number 2017-048, which formally established the ISDN in the city. We also have the Executive Order Series of 2021, which declared adolescent pregnancy as a local priority of the Iloilo City government. And ultimately, we have the Regional Development Council Resolution number 57, Series of 2018, which basically engaged Sangguniang Kabataan funds to augment adolescent programs and services. With TCI support, Iloilo City dramatically expanded its capacity to serve adolescents. The number of trained family planning providers grew from just 3 before the pandemic to 15 certified professionals capable of delivering long-acting methods across every health district. The city also scaled up adolescent-friendly health facilities, increasing the number of district health centers, striving for Level 1 certification, and appointing dedicated focal persons for adolescent care. Through these efforts, the Iloilo City Health Office ensured that each district center received the Adolescent Health and Development Program Foundation course, which provided healthcare providers with the essential skills and knowledge to deliver consistent, quality care. The city now aims to accredit every barangay health station as an adolescent-friendly health facility, vastly expanding adolescent health services to remote and underserved communities. As TCI worked to strengthen the leadership capabilities of the AHDP team, new levels of collaboration emerged. The technical working group expanded to include key stakeholders such as the Department of Education, the Iloilo City Police, TESDA, Sangguniang Kabataan, and local colleges. This broader coalition ensured that adolescent health received multi-sectoral support, aligning resources and activities towards a shared vision, a future where every Ilonggo adolescent has access to the information, support, and services they need to thrive. The Iloilo City Population Office, empowered by leadership, coaching, and an unwavering commitment to the youth welfare, launched yet another new and innovative youth engagement initiative. That is the Adolescent Health and Development Film Advocacy Contest. It is conducted in partnership with the University of the Philippines, Visayas, and gave our youth a creative outlet for health promotion. Meanwhile, Iloilo City Health Office HECHOSERA, which stands for Healthy Choices for Self-Confident, Empowered, and Responsible Adolescents, is a mentorship program led by community volunteers. It is designed to build life skills and provide psychosocial support, reminding us that healthy choices are nurtured by community compassion, especially when guidance comes from those who once walked in the adolescent's shoes. Today, Iloilo City is proud to report a significant decrease in its adolescent birth rate, from 36.76% in 2019. We now have an ABR of 23.9% as of 2024. We have also seen decline in the teenage pregnancy rate among 9 districts comprising Iloilo City. However, the work is far from done. There remains an undeniable urgency to continue the fight. The Challenge Initiative has not only revitalized systems, but transformed people. From hesitant program officers to empowered community leaders, the TCI Iloilo City team has set a new standard for leadership. Bold, inclusive, and deeply committed to equity and impact. In the years ahead, Iloilo City will continue to protect its young people with TCI's leadership, fueling the drive to shape healthier, brighter futures for all. The love Iloilo City is known for will now be felt even more deeply by the youth it strives to uplift. Ladies and gentlemen, that ends my presentation. Thank you for listening.